I feel like infertility, rates have been raising on a very drastic level over the decades, right? And you've been in this industry for over 2 decades right now. So why are more couples struggling to conceive today compared to the past generations? So why do you think that's happening in the first place?
Yeah, you're right, because we all know that infertility cases are rising. Not only in India, it is like a worldwide phenomenon. Okay. Mostly there may be several factors. It's not like that one factor we can pinpoint to something. If you take like a globally, temperatures are rising, the men's sperms are going down, number of count or the motility is all over the world. The sperm counts are decreasing, like in generally, and social factors. Lot of them, if you think like a age at marriage, or like a civil partnerships are increasing, and couples planning like their first child are increasing, age at which they are planning, and the most of the other thing is like a lifestyle factors.
Yeah, thank you so much for joining in today, doctor. And I'm very excited to learn more about IVF, fertility, and how over the years infertility has risen. And if you see the past 10 to 20 decades, and I think more than one could have been better to discuss this. And thank you once again for joining us today.
Thanks, Afsar. Thanks for giving me this opportunity to share what are the real causes for the infertility, how we are addressing in our center, how we are trying to help the couple, that we can share so that it can be educating to the couples who are there.
Yeah, sure. So just before discussing all that, sir, I just want to understand with your 20 years of experience, which is like a very extensive experience, and when the countless couples you've dealt with, right, and the infertility cases and a lot of babies you delivered, and the happiness that you gave to the families, to the parents, and also like the new couples. So I just want to understand what made you get into this reproductive medicine and IVF. What got you interested in this in the first place?
So mainly when I completed my master's in Government Medical College, Bellary, I was just looking for a further training, like a super specialty in the field. Then I went and joined Just Look Hospital in Bombay. So where interestingly I come across like Dr. Indira Hinduja, who did the first IVF baby in India.
Okay,
I was very fortunate to work with her. And also there was another consultant called Dr. Firoza Parikh, who had just trained in US and started a fertility center in the Just Look Hospital. When I started working with their team, then I started developing interest, so that lot of couples who think they will never get pregnant, never can have a babies, this technology was like a miraculously trying to help them and solve their problems. I thought it is wonderful. Why can't I get trained in this and other things? So with their help, I went to UK, where I got trained in this infertility and IVF. I stayed there 14 years, then started working in the best IVF center called the London's Women's Clinic there. So then later on, the history. Then I ended up coming back 10 years ago to the Vizag, setting up the state-of-the-art IVF center. So we started helping thousands of couples here.
Understood. That's so great, sir, because obviously as the development of India, usually we look into the the West or other countries where you want to go there, obviously for the career development. But then a lot of very less people come back to make the system over here to get that treatment in India with the prices like India, and then how well established those the whole system is over there, and then get that over here in India. I think that's something that's really something that we are looking up to, and would love to know more in the further conversations. So with this, sir, I feel like infertility rates have been raising on a very drastic level over the decades, right? And you've been in this industry for over 2 decades right now. So why are more couples struggling to conceive today compared to the past generation? So why do you think that's happening in the first place?
Yeah, you're right, because we all know that infertility cases are rising. Not only in India, it is like a worldwide phenomenon. Okay. Mostly there may be several factors. It's not like that one factor we can pinpoint to something. If you take like a globally, temperatures are rising, the men's sperms are going down, number of count or the motility is all over the world. The sperm counts are decreasing, like in generally. And the social factors, lot of them, if you think like a age at marriage,
Okay.
or like a civil partnerships are increasing, and couples planning like their first child are increasing, age at which they are planning. And the most of the other thing is like a lifestyle factors. Know that obesities are increasing. So in women, if you take mainly because of the obesity, most of them are suffering when they're coming with the infertility history, PCOD, like polycystic ovarian disease. With that added obesity, make the things worse. They won't release the egg, they won't get pregnant. Then if you take men, again, because of the increase in obesity, type 2 diabetes, blood pressure are increasing.
Okay.
And again in men, smoking and excessive alcohol. All these things, the changes are going on. And again, like a working pattern, if you think like earlier, usually men used to work, women used to be at home, like a typical Indian family settings. Now, no, both are working. They may be working in different place, or they may be working like a unsocial hours, where they get a very less time to chance meet other. So all these things with added environmental factor, pollution and other things, definitely they are increasing the infertility rates.
Got it. So, do you think also the food habits are, also being one of the main reasons for that?
Yeah, exactly. So the food definitely it contributes to the most of the things. With unhealthy food habits, especially as you know now with the more and more multinational food chains are coming up, like you can see everywhere, like a fast food centers picking up. Those with the now teenage girls are coming up with a lot of obesities, PCODs, unhealthy food habits, where lack of exercises, all these things is definitely contributing to the infertility rates, increased ones.
Got it. Also, sir, I think over the years, right, and has an Indian mindset, I might be wrong, but I think there's a common belief that infertility is mostly a woman issue. And I think that's what, mostly, let's say in tier 1 or tier 2 cities, which is mostly like 80% population in India, right? So when you say infertility, mostly the first thing that goes in the mind is like, okay, maybe there's something, a woman issue and not the men's. So how much of the infertility cases you have dealt with, which falls under the woman category or men category, or what is the myth behind this?
I think, again, it is a cultural issues in India. It is completely wrong just to blame the woman. She is only responsible for the things. I come across sometimes, it's so sad. The couples come with the mother-in-law or something, where husband doesn't have any sperms. Okay, but which was not revealed. But the mother-in-law keep blaming the woman. They're married for so many years, still she's not able to give a baby to her son or her family like that. But the poor woman not able to reveal because she's trying to protect her husband. And husband is not open enough to express his inability to have the child. So you can see how the cultural things play the things. But if you take like a scientifically, only woman is responsible for around 30 to 40% of the infertility cases. Equally men causes like around 30% responsible for the cases why they are not able to get pregnant. In remaining 30%, it may be both or what is called as like a unexplained infertility, where we do some tests which reveal normal, but still they are not able to get pregnant. So those cases roughly around 1/3 of them. So it is not true, only woman is responsible.
Got it. Also, for not having fertility issues, usually people getting into the IVF clinic is something that they think about a lot, right? Like they might, there are a lot of like questions that raises in them, and then they'll be like, okay, is that even necessary on a psychological level to start with? And also the financial level has a second option. So a lot of couples, they take longer period of time just trying to do it naturally, and then they Google all of that, like the best remedies or what are things that you could do naturally. So do you think, is it the right way, and how much people should wait before they consult an IVF
So again,
specialist.
it's a very important thing. It again comes with the scientifically, what are the chances if the couples, both are same, both doesn't have any problems or something, if they try to plan for the baby, if they're not using any contraception or something. So it's very interesting. In a first year, only 80% of the couple can able to pregnant.
Okay.
Okay. Even if everything is normal.
Okay.
Okay. Because there are several factors play a role to get a pregnancy. If the couple, like a good in a reproductive age between 18 to 25 or 30 or something, if they try second year, another 10% can get pregnant, means around 90%. Remaining 10%, they need some help. Okay. So what I mean to say is, if the couples doesn't have any problems, if they're healthy, everything is fine, recently married, they're young, they can try for 2 years maximum. If they still fail to get pregnant and they're not using any contraception, they should seek infertility centers help.
Got it.
Okay. Whereas if say like a woman is like age 30, 35 and above, or if they're known to have some problems like a PCOD, fibroid or endometriosis, or man has gone and tested somewhere else where the count or the motility is less or something, if they come to know there is no time limit, they should better to reach the center as early they can so that we can investigate and help them.
Understood. That's great. So how does the whole IVF thing work? So if people who don't know what IVF is, so if you can explain what IVF is and what are the major, red flag that indicates couple might have fertility issues, and then you should, directly, search for IVF.
Again, the red flag, as I said earlier, if they try for more than 2 years, if they doesn't get pregnant, if they got some pathological conditions like fibroid or any endometriosis or something, then they need to reach the IVF centers. Then regarding the process of IVF, if you come, it's a process which is done in the clinic and the lab, simulate the natural conception which happens in the body. For example, if you take, what happens is naturally is one egg releases in a woman in a monthly cycle. During that time, when she meets with a husband or a partner or something, sperms can go up, interact with the egg. One of the sperm, which is potent enough or which is healthy enough, penetrate the eggs and get fertilizes. It travels through the tube, comes to the uterus, then it attaches. Then the test after 15 days, usually they become positive. So the same thing we'll try to simulate or help in the lab here. So what we do is, if the woman, once they approach the center, we investigate and check the couples, then decide this couple needs a fertility treatment like an IVF. Then what we do is, we start stimulating the woman's body with the natural hormones called like a FSH hormone injections. Normally she would have produced the one egg in each cycle. By giving these medicines or similar to the body hormones, they make woman to produce more than one egg.
Okay.
Say that 5, 6, 10 or something like that from both the ovaries. Once the egg reaches appropriate size, say that around 18 to 20 millimeters or something, or a follicles, then we subject the woman under anesthesia without a pain. Then with the simple procedure with ultrasound guided, we just aspirate the eggs out. Then we'll take the men's husband sperms, wash them, select the good sperms, and we'll make sure that they enters the egg of the woman in the lab. Then very next day we check whether it is fertilized. Once they fertilize, then we'll grow them in the lab up to 5 days, what we call it as a blastocyst. So this is the stage of the embryo. Usually, normally it would have gone and attached in the woman's uterus, naturally. But here, these things are not happening naturally. We're helping them in the body. Once the embryo is ready, then with the small tube, just like without any painless procedure, we just transfer this embryo into the woman's uterus or a womb.
Got it.
Then rest left to the nature. All it needs is just attaches, then bingo, it will be a positive or something like that. Or sometimes it can fail as well.
Got it. Okay. So, is our fertility problems genetic in nature, sir? Because let's say if a woman is actually having the family history of like, infertility or maybe like miscarriages or something. So, do you think there are high chances if the mother is having, the daughter will also have it at the first place? And if the mother can have a trouble conceiving, is it true that even daughter will have it, or is it like completely natural?
Yeah, we normally we face these questions during our routine clinical consultations or something. Sometimes couples seek help after 10 years.
Yeah.
You ask them, why were you so late?
Yeah.
Then they say, sir, my mom got pregnant after 12 years of her marriage. So we thought, so maybe 10 years, let's try.
Yeah.
That's the reason I may be getting late to get pregnant or something. Actually, the genetic factors sometimes play a role for a woman conceiving or getting pregnant or something. It is not always. Okay. Majority of the times, it is not the genetic factor. It is the environmental factor, hormonal factor, egg-related issues, or the sperm-related issues. Maybe those are the main reasons why woman is not getting pregnant. In very few percentage of the cases, say that around 10% of the cases or 5% of the cases, genetic may play a role.
Okay.
Especially when we try for multiple IVF cycles or fertility treatment, if it keep failing or something, then that is the time we may start thinking whether the genetics is the reason or something. Okay. One of the reason or one of the condition where we can relate mother and daughter is sometimes what we call as a premature ovarian failure.
Okay.
Okay. See, when the woman or a girl child is born, she is born with certain number of eggs.
Yeah.
They keep ovulating from the puberty every month. Okay. They lost, say, like approximately around up to 45 years of age.
Yeah.
Imagine if that girl is born with a very less number of eggs than what is required for her. So she'll stop producing the eggs,
Yeah.
maybe 30 or 25
Okay.
or maybe 21.
Okay.
So her ovaries are failing prematurely than what was supposed to do.
Yeah.
So these girls or a woman who was born with a less number of eggs or inherited a condition from her mom, then her egg quality will be very low, egg numbers will be very low, and she may reach menopause at a very early age. So because of these reasons, she'll have a hormonal imbalance, not releasing the eggs, then she'll be infertile. In such woman, we may be better to explore the genetic related conditions than plan the treatment options.
Got it. Okay. So also in these cases, what is the role of the sperm and egg freezing? Because I think you see a lot of celebrities doing it, and you hear that a lot, like the whole freezing of eggs and freezing of sperm, right? So is it really an option for those who want to delay pregnancy, or like what is the whole truth about that? So who do you think can do it, and why should people do it or not do it at the first place? What do you recommend?
As I said earlier, because the lifestyle factors nowadays making a lot of the voluntary infertility has become like the things. If you come to the sperm freezing, usually sperms, in most of the men or unrelated to the age, every 3 months, new sperms are keep forming. Okay. So very rarely age is the one which affects the fertility or anything in men. So that's why sperm freezing is not very, very popular or something.
Yeah.
Usually we use this sperm freezing only for a process of IVF as a backup sample, or if the man or a husband is staying in an abroad, or who's working somewhere else, so where woman is staying in India, or they want to try a fertility treatment, during those course we freeze the sperms. Okay, but if you come to the egg freezing, it is completely different thing is going on. If you take like a software companies like a Facebook or Apple, like a lot of multinational companies nowadays offering a employee woman egg freezing as a free or as a one of the like a what is like a bonus thing for them. Because why is the truth behind is, as I said earlier, now by the time a career woman, by the time she finishes her post-graduation, find a job, settle down, plan a partner or a husband, then again couple of years, then you want to plan a baby, by the time she would have crossed easily 30 or 35.
Yeah.
So as I said earlier, the egg quality and numbers keep falling with the age. Say that if the woman want to plan to try after 35, her chances of getting pregnancy naturally goes down. Even if you try for a fertility treatment, success rate is very, very low. So with this background, what they do is say that a young woman around 23 or 25 now go to the fertility center, goes through the process of just a stimulation of the eggs. Eggs will be developed, they'll be taken out and frozen in the lab. Okay, she comes back after 5 years, say now she's 30, she tried naturally for a year, she didn't get pregnant, then she comes to the center. So now the egg which are frozen of around 25 years of age, now she is 30, her egg quality has gone down, that's why she's not conceiving with the procedure. Now you take those eggs out, create an embryo with the husband or a partner who's there now, then transfer those embryos, then succeed.
Okay.
So what I mean to say is like a time machine.
Yeah.
So you are going back to the time when during your younger age group, so you are frozen for the future or you insured for the future, then take out those eggs, plan the treatment, then it helps you. It has helped like thousands of women, and nowadays egg freezing has become a very, very popular process and one of the most important thing for the fertility centers as well. That's the reason a lot of celebrities or high career women and other things, they're going for egg freezing because they haven't found the right person now. They have not ready for the family now. So these frozen eggs can be used for the treatment whenever they're ready or whenever they find the right person. So that's the time these are useful.
Got it. So are there any side effects for this? Like, let's say when you're saying we can freeze it and then, revisit that after 5 years or 8 years, and some people can do it after 10 years. So will that be any, will there be any repercussions coming with that? Or is it like...
See, usually egg freezing procedure is a very simple and very standard procedure.
Yeah.
During the procedure time, sometimes there may be a chance of infection, bleeding, or ovaries getting hyperstimulated and other things.
I think that background noise will come in. Yeah. So I think with egg freezing, which is, something really great, and it's like a time machine and you can, visit it back. So are there any repercussions that comes with it? Because when you're freezing the egg, people are visiting that after like, let's say 3 years, 4 years, and also 10 years in some cases.
Yeah.
So what are the repercussions that comes with that? Because freezing for a very long time, is that something that's, healthy, or what would be, the, chances of that failing when you're trying to, do it like fertility after a point?
So usually, egg freezing is a very straightforward standard procedure. As I said, there will be some small complications can happen, like a bleeding, infection, sometimes ovaries getting hyperstimulated. These, we can see with the standard treatment and the management, it can be controlled. As your question comes is, if they freeze for like a 3 years, 5 years or something, what will be the outcome or something? Nowadays, the freezing procedures are very, very high quality, very high standard ones. Usually what happens is we freeze the eggs to minus 150 degrees or something with the liquid nitrogen. They just stop growing or moving or anything. Whatever the condition they are there, they stay there. Okay. Whenever we want to use them for a treatment, then we get them back. What is called as a process called a thawing. Means from the minus 150 degree, we get them back to the 37 degrees in the lab. This is a very meticulous procedure. Usually with the trained embryologist, they do this procedure. There may be some eggs getting damaged. So usually recovery rate is around 30 to 50% of the eggs. You can recover them back to the original conditions. Then you can inject them with the sperms, then create an embryo, then use it. Then if you ask like whether because of that whether there is any damage to the future babies or there may be an increased risk and other things. Usually most of the scientific studies have proven there is no, comparatively with the normal other pregnancies or something, there is no increased risk of any abnormalities in the babies or anything. So it is a standard and a safe procedure.
Okay, that's great. So what are the main reasons IVF treatment fail? Because you told, like, you might have cycles, and although in London IVF, I know there are a lot of patients that came over who actually got that success in the very first try, right? And there are a lot of couples, while they're trying with the multiple clinics and they're having, failed cycles, and it's not getting through, and they're not getting, like, pregnancy, and there's no success rate. So what can couples do anytime to prove the child? So what is the chances of them to get that better, and how should they deal with the failed IVF cycle, and why is it failing at the first place?
Yeah. See, one thing we all need to understand this is IVF treatment is a scientific treatment. It is a standard treatment, which is not 100%. Okay. So a lot of the people, they think because they're spending a lot of money, they're going for this newer procedure, which has got a modern technology and everything. So we will get the result, maybe not one cycle, maybe the second cycle, or 100% guaranteed or something. That's not true. Okay. Even with the best hands, best trained hands, and the best equipped lab and everything, the success rate mainly depends on woman's age, woman's egg quality, and the partner or a husband's sperm quality, and the motilities, their hormonal pattern, the where the baby is going to attach, the lining of the womb, and any other like abnormalities are there. Not only that, so what are the condition of the lab, like where these IVF treatments have been done? Has there been ART certified IVF center, whether the people there are very well trained, are they using the good standard medications, culture medias? There are so many factors play a role for a success of IVF. Again, no, as I said, most of the times it is the quality of the egg, the woman's age is one of the most important thing which determines the success of the IVF. Okay, say that a woman with an younger age comes, the success rate will be very high. In our center, less than like around 30 years of age, where the things are not really bad. Therefore, most of the sperms and other things looks okay, but they still fail to pregnant or something. No? Such people, we get like around 50 to 70% in the first cycle itself. Whereas if you come across a woman who's 43-year-old, okay, with husband, seven parameters are borderline, if they try, the success rate will be only 10 to 15%. So these are the reasons why sometimes IVF fails.
Got it. So what is the most challenging? So in your two decades of experience, right, and you worked in UK, and also you're practicing over here, and you're changing the lives of a lot of couples, to achieve their dream of parenthood. What is one case that was most challenging for you to deal with, and how was your experience, and how did you deal with that case, and what is the most challenging one that you ever come across that always stays in your mind, or maybe like when you think about it in your career? So what is that one case for you?
Yeah. So yeah, one of the case which I can really remember where we went through the multiple things or something like that is one of the couple from nearby called Vizag. They had a grown-up son who went to the school or something. Suddenly when he got from the bus or just traveling to go or something like that, just because of some accidental issues, they lost their son.
Oh my God, okay.
Okay, it was like a big tragic accident as a family members, was losing a grown-up child or something like that.
Yeah.
So they, on their third day of the child passing away, they immediately approached our center. Okay, because they were so much disturbed. Somebody has just informed them, there is a doctor from the London has come, they might help you or something. So just on the third day itself, they came and seek the help of our center. Then we investigated the the couple like a basic things, counseled them extensively
Yeah.
because they were completely traumatized
Yeah.
and other things. So we went through the process of IVF. First cycle it failed due to the various reasons, but the couple were very determined. Then we went through the second cycle. They got pregnant, and they were all over the moon. They were very happy, and still that sorrow was not completely taken off or something. Then things were looking fine, but unfortunately, I think these couples, there was a lot of challenging times still they were about to face. There's roughly around fourth month or the fifth month, end of fourth month or the early fifth month of the pregnancy, the woman's water broke.
Okay.
Okay, that's a very very rare, but sometimes it can happen due to the various reasons or something. Then the options was terminate the pregnancy
Okay.
because it's too early.
Yeah.
The baby can't survive,
Yeah.
and if you're continuing the pregnancy, can leads to infection.
Yeah.
And it can spread into the woman, then it can endanger the mother itself. Then, or continue the treatment,
Yeah.
means just balancing the act and other things. But the odds of continuing the pregnancy was very low. But the couple, no, they were very determined. They just wanted to continue the pregnancy, take the chance and other things. They had extensive counseling with the multidisciplinary team involving the obstetrician, neonatologist, what happens in case if this baby delivers now or after a month, what are the chances of baby having abnormalities, breathing difficulties, or mental developments. There will be a lot of things will be involved in case if the baby is born very prematurely or anything like that.
Yeah.
But we, with the as a multidisciplinary team, we all just managed continually monitor the woman for every weekly blood test, scans, and giving the medication for the babies completely to mature and go on. You know, that's it's like a miracle. They went up to 30 weeks of pregnancy, like up to the 8th month,
Okay.
just like around 31 to 32 weeks after giving the injections for the baby's lungs to mature. Then they underwent a cesarean section. They delivered a healthy baby, and they are doing very well. Now I think the baby is a child is around 4 or 5 year old,
Got it.
and so the parents think their lost son has come back again.
Okay.
So that was the one which I can think. It was like how much couples can go through the process of having a child when they lost a child or when they're not having a children.
Yeah. Yeah. Back to the so that was really great, sir. I know for a fact that if they did not approach you, and then obviously you did everything. You went leaps and bounds to help that woman, which is the most challenging case at the time. The water broke, and a lot of factors come into place. And you also made sure you had a lineup of experts to help that woman, achieve her, a parenthood dream after what they have been through, right? And for the follow-up question, last time when I was having a conversation with a cardiologist, and he said about the holes in the heart of babies when they're born, right? And sometimes when they're scanning while they were in the womb, and few of them miss it, and then while we talked about you giving treatments and injections for premature lungs to get that developed. So I think if we can relate that, and then also talk about why do babies have holes in the heart in the first place, and is there any point of the treatment while the pregnancy that someone misses that point so that they discover it later? So what is the whole story behind that?
See, most of the babies born naturally or with the fertility treatment or anything, they're all well formed without any problems and other things. Okay, touch wood. There may be very few percentage of the cases babies can have some cardiac abnormalities. Means where the problem is the hole in the heart and other things and all like that. Even though science has developed so much, we have got so many blood screening procedures, scans and everything. Not all the scans can pick up all the problems in the baby's heart.
Yeah.
Okay. Majority of the times, they'll pick up big structural defects, like say that the big hole or reversal of the blood flows or any big problems or something. No, usually experts will pick them up. But sometimes some minor things, issues, some minor problems or few conditions, you may not able to pick it up. Okay, whoever they may be, how much ever they would have trained, whatever may be the expertise or something, it's not 100% they can able to pick it up. Sometimes no few things can go miss or few things can be diagnosed only after the birth. But for the most of the conditions nowadays, no, you will get a treatment. There will be a fetal medicine specialist. They'll go through it. Fertility treatment as itself doesn't increases any cardiac problems in the babies or anything. It will be almost the abnormalities, chances will be same as that of the natural pregnancy.
Understood. Okay, got it. So what is the difference between the IUI, IF and ICSI, right? And treatments, I think a lot of people, they don't know. So when they think of fertility, IVF is the first thing that comes into the mind and not the other two.
Yeah.
So if you can explain what one of those terminology is and why is it used in different cases?
So these all three are different types of the fertility treatments. Okay, IUI stands for intrauterine insemination of the husband's sperm or a donor sperm. Okay, so what happens is when the condition is very simple, like as I was telling you earlier, if you investigate a couple, 30% may be woman's problem, 30% may be a man's problem. In remaining 30 to 40%, we may not find a reason.
Yeah.
That we call it as an unexplained infertility. In such cases, sometimes this make the woman produce the egg, track them through the scan. When the egg is released, take husband's sperm, if it is suitable, then wash it, take the concentrated, highly motile sperms, just inject them into the uterus. So intrauterine insemination. So injecting the sperm inside the uterus, where the sperms are nearer to the egg, hoping that they'll interact with the egg and they'll get pregnant. Okay, that is the IUI procedure. It is very simple and cost effective. Less cost is involved. That's why everybody prefers. But the disadvantage is success rate is very low.
Yeah.
When they try for like 3 to 4 cycles, the success rate is around 10 to 15% only. So it can fail in 90% of the women. So that's the reason, if the couple has tried quite a long time, if there is a husband's sperm is completely defective or anything, this is not suitable. Okay, this is suitable for only very limited number of patients. If they're trying for IUI, they shouldn't try more than 3 times. If they try for more than 3 times, even if they're not getting pregnant, they're not going to get pregnant. So after the 2 or 3 attempts, if it is nothing is happening, they better go for an IVF. Okay. Then if you come to IVF, I already explained you earlier, IVF means in vitro fertilization. So it's where we are just helping the egg and sperm to meet and get fertilized outside the body. That is called IVF. ICSI, what you call it as a ICSI, which stands for intracytoplasmic sperm injection. It is a form of a IVF procedure, slightly higher up. Normally what happens during the IVF procedure, we aspirate the eggs in the lab, then we process the sperm sample, we put the sperms on top of the eggs. So egg will select which sperms to enter inside.
Okay.
Okay. So sperm actively, which has to break the egg's cover and enter inside.
Got it.
Okay, it is like a natural selection of the sperm, which sperm needs to enter inside the egg. It is almost simulating to the normal one. Whereas say that there are some couple where the husband's sperm is very, very weak. Count is just a 1 million or 1 or 2 only motile sperms are there or something. In such cases, IVF doesn't work. In such cases, what we do is we have got a specialized equipment called ICSI machine. In that we hold the egg, embryologist will, with the specialized in these things, stabilizes the egg. Then whatever that one single motile active sperm is there, select it in a needle, specialized needle, under 300 magnifications, just inject directly the sperm inside the egg. Normally it would have been happened naturally.
Yeah.
Due to various reasons which is not happening.
Yeah.
So directly you are injecting the sperm into the egg. So intracytoplasmic sperm injection. So then it fertilizes, then the process will be similar to the any other IVF procedure.
Yes. Also, London IVF is considered one of the best centers in Vizag, right? And you've been running this, and you have a lot of centers, and you've dealt with a lot of patients and cases, and then babies you delivered, and very healthy babies, celebrating their birthday when they come to you and then say how happy they are. So what is the unique treatment that people are getting in London IVF, and how are you standing out from the rest?
Yeah. Thank you. See, as you said, we're not only the best IVF center in Vizag, we're best IVF center in Andhra Pradesh. We have consistently been, with the Times Group, has been recognized us as one of the best center. Not only in just case of the a success rate, the way we treat the patient is completely different. See, as I was telling you earlier, when we are working in the UK, planning to set up a center in India, in a Vizag, our main aim was to get the London treatment into the Vizag. That was our plan. Whatever the way, a systematic protocol, guidelines based treatment, treating the patient in a holistic approach, treating them with courtesy, confidentiality, ensuring them, counseling them properly, allowing or offering them one-to-one treatment, and throughout the process supporting the woman going through, because it is a physically, financially and psychologically it is very draining when the couples are going through these things. So we have got the support structure at each stage, whether they succeed or fail, how to counsel them, how to create a hope in them, how to find alternative treatment and everything. Not only that, as I said, we have got a very high success rate. We will try to offer the treatment at a very minimal cost wherever is possible and other things. And not only that, we have also offer very advanced treatment like genetics, embryo biopsy, so that the people who have failed IUI or IVF in other centers can seek help through us. We as a tertiary referral center, we can help such couples to where they have lost the hope. Such people, we can offer them further alternative procedures which is available, so that increases the success rate and so on.